Welcome to the Plant Trainers Podcast, where we're helping people improve their quality of life through nutrition and fitness. And now, your hosts, nutrition and wellness coaches, international speakers, Adam and Shoshana Chaim.
Hey, I'm Adam Chaim.
And I'm Shoshana Chaim, and we are Propelled by Plants.
Today we bring to you episode 393, Prescription for Better Health with Dr. Baxter Montgomery.
In this episode of the Plant Trainers Podcast, we talk with Dr. Baxter Montgomery all about complex medical illness and a prescription for better health. While Dr. Montgomery has been practicing cardiology, he has many patients that have other illnesses as well. Everything seems to overlap. He's doing everything he can to encourage his patients to adopt a whole food plant-based diet, but he finds that there are so many who are not willing to go that extra mile or who are still not getting the results that they expected while doing so. On social media, you constantly see pictures and stories of people who are saying within 2 months, within 3 months, all of this happened, but that's not the case for everybody. You'll hear how childhood, past experience, and environment sets many up for their health as adults and what fundamental approaches can be taken.
Dr. Montgomery is a Board Certified Cardiologist with many years of experience in the latest medical practices in nutritional health. He's a clinical assistant professor of medicine in the Division of Cardiology at the University of Texas in Houston, a fellow of the American College of Cardiology, and the founder and president of the Houston Cardiac Association. Having seen many patients suffer the consequences of chronic heart disease, Dr. Montgomery founded the Montgomery Heart and Wellness Center in 2006 with the mission to reverse and prevent life-threatening illnesses. The Montgomery Heart and Wellness Center is a state-of-the-art wellness facility complete with all the technology and resources to provide comprehensive medical and wellness care. This is a great episode, lots of amazing perspective that can really help out so many people, so enjoy the show and please share it out.
You've told us that you're bored of what you're cooking. You've told us that you're not eating out as much and you want to be a little bit more entertained with what's on our plate. So we showed up and we made the Plant-Based Comfort Foods cookbook. It is an e-cookbook that is above and beyond what we've done before. The pictures are gorgeous. The recipes are easy, but they're going to look restaurant quality. We are super excited for this book and we can't wait for you to get your utensils on it. Check out the link in the show notes or check it out at planttrainers.com/shop.
And now for a moment of gratitude.
I've onboarded many clients in the last couple of weeks. New year, new you. And one of my clients in particular who's using one of our products messaged me today to say that he opened the box yesterday and by the time he went to bed at night has really found some great results already. And to me, I'm just grateful that people are willing to use products that are not going to cause any more health issues within their bodies. And I'm grateful that they listen.
I received a message from a former student with a really nice email letting me know the impact that I've made on his life. And I'm just so grateful to be able to make that kind of an impact on even one individual.
We hope that you've taken a moment to think of something that you're grateful for. And if you are grateful for this show and you want to show your gratitude, you could head over to buymeacoffee.com/planttrainers and you can buy us a coffee to help keep the lights on here at Plant Trainers and help bringing you the most amazing guests so that they can be on the show as well. That's buymeacoffee.com/planttrainers. Dr. Baxter Montgomery, thank you so much for joining us on the Plant Trainers Podcast today.
Thanks for having me.
We're very excited to talk about absolutely everything and anything with you because you've been on our radar a very long time. It's been 6 years in the making to get you on this show. We would love to know before we begin what your moment of gratitude is.
Well, it's a great question. I'm so grateful for so many things. Knowing God and knowing who He is and being able to call out to God, I think is the thing I'm most grateful for because, despite any type of trials and tribulations, in order before someone stands up strong, you have to bow down. And the fact that I, from a very early age, understood and learned the power of bowing before God and submitting myself before Him is the thing I'm most grateful for because that's the foundation upon which everything else stands. So, have a beautiful family, beautiful kids. My son finished his first, semester in law school, and I'm very proud. I remember him when he came out of the womb, and now he's, his first semester in law school. He's doing well there. My oldest daughter is a senior in a college at Tulane here in Louisiana, in New Orleans, Louisiana, here in the States. Interesting, my youngest daughter, who's applying for college, now I have 4 kids, and 1 boy, 3 girls. And so she had an interview at Louisiana State, which is in Baton Rouge, about an hour north of New Orleans. And so we flew into New Orleans, and I called my older daughter, and so she picked us up from the airport, took us to the hotel, and then picked us up the next morning, drove us to Baton Rouge, and we toured and came back. And so I was reflecting on that moment on the way back from Baton Rouge to New Orleans, and there I am. I've got my youngest daughter who's applying to college. My oldest daughter is picking me up and driving me, and she's a senior, and she had a roommate picked us up. My middle daughter, she's in design school in Atlanta, and she'll be flying in, and it's just a beautiful thing to see how these kids, they came, from, conception to the womb. They grew up. I remember all the times we spent together, and the difficult times. And I don't know if you raise young girls can be challenging.
We're doing it now.
And so it's been I don't want to say a battle, but a journey. And so to see them at this point and to enjoy them at this point, see them growing into responsible adults, being able to interact with that, it's just a beautiful thing. It's just a very special moment. And my dad would teach me, both my parents taught me the importance of investing in your kids, investing in your family. And I knew that from growing up. And so having done that, and kids can be expensive from diapers up to college. And I mean, it's just, it's extremely expensive time. But that there's a return that comes back that's multidimensional to see them grow as young adults and doing things. And my kids aren't all plant-based, but like my daughter in Atlanta, she's converting more to plant-based, and their, that, of course, is influence. So I don't want to go on too long, but just to see the growth and development of them to come from where they were is just a beautiful thing. And so I thank God for that every day, among the many other things that he's blessed me with. So anyway, that's...
It's really incredible how it makes me think about our kids, because we have a son and a daughter, and they're 10 and 12, and the time is going by so quickly already. And you're talking about yours that are already in college, and it's unbelievable how quick time goes. We really got to take advantage of the opportunities that we have when they're with us, and we have to spend with them because they're so valuable. So yeah, thank you for sharing all that.
And so 4 children, any doctors in the family?
It's interesting. I don't think so. My oldest daughter has for a long time said she wanted to go to medical school, but I think she's changing now to law school. So I'm going to have a talk with her. We'll see.
And you mentioned that they're not all plant-based. So what came first for you? Was it plant-based or was it medicine?
Medicine came first. So it's interesting how that came about because, I wanted to be, I knew at the, ninth grade, I decided I wanted to be a doctor. And then, that whole process evolved to college and never looked back. And my training in medicine, started out the traditional way in the medical school. I enjoyed that. At that point, I think the summer between the first and second year of medical school, I made the decision that I wanted to go into cardiology. And so, once I made that decision, I never looked back. When I got into my internal medicine training, then I decided I wanted to subspecialize into cardiac electrophysiology. And so then when I applied for my cardiology fellowships, I went that direction. And so I went that whole route. So I did my cardiology fellowship, then my cardiac electrophysiology fellowship. And I was also learned about business. And so I met my CPA long before I finished my training. And he taught me to incorporate, which was important because I got into the aspect of when I was doing my moonlighting, I did it through a little corporation I started. And the reason I point this out is because during my training, I learned important aspects of running a business, which, I never would have learned had I not done this simple thing such as incorporating and ran my moonlighting through a corporation. So when I got through my advanced training in cardiology, it was my mindset to go into my own practice. So when I finished my training, I never worked for anyone. Now, that's an important little detail there because So I started my own practice in 1997. And so I was a cardiologist, cardiac electrophysiologist in the Houston area. I went to different hospitals, I had privileges, and I just started building my practice, seeing patients in the emergency room, getting referrals and the like. So my practice grew. Now, this is all before I learned anything about plant-based anything. And so, but I did have one notion, which is that I had an interest in wellness. And we had cardiac rehab facilities in the training institution. I knew about cardiac rehab. And so I had the mindset I wanted to create my own cardiac rehab facility and the like. But it never really materialized. I didn't know exactly what that meant. So as the practice grew, I got busier and busier. My family came, after I got married, family, kids, and all that stuff. And so I was very busy. And of course, my health started to deteriorate and so on and so forth. And my cholesterol was elevated. And then I, started reading materials in the lay press about natural cures and the like. One of my patients came in, he was on a lot of supplements, and I was asking him questions about that. And I went and he was seeing an herbalist. And so I saw her and started learning about natural cures and so on. So while practicing medicine the traditional way, I was also developing a mindset or a knowledge base, if you will, in this other arena. And in the context of that independent study, I then started learning about plant-based nutrition, because everything you read about, take this snake oil plus eat plants and you'll get healthier. Do whatever plus eat plants. And then I don't know how this came about exactly, but I took a weekend course to train as a raw vegan chef. So it was like a raw vegan certification course, a 2-day crash course here in Houston. And I think I saw a brochure. I don't remember exactly how it came about, but I took the course. So in the context of going to that course, and it was actually sponsored by a person who was promoting, she was like a animal rights vegan person and so on. And so this is one of the activities she had. I learned so much about, plant-based nutrition. Plus I got some resources of people in Houston who promoted this. There was one person here, John Rose is his name. I'll mention, he won't mind. But he was an expert, if you will, in juice feasting. And so he would coach people to juice feast. So I met with him, and this guy knew everything about food, it seemed. We met at a Whole Foods store. We sat down, and I think for the first 3 to 4 hours, I peppered him with questions, and he had answers. He had his book bag and with books and things. And I think we talked about 3 or 4 hours before we stood up and stretched. And then, we met, and then we toured the store, and we talked about food and how nutrition and things like that. And of course, he tied into politics and medicine. So I decided to do his course. I paid him, and he coached me through a 30-day, an intervention during 33 days of raw juice. So my, personal introduction to plant-based nutrition was a raw juice feast. And he was a raw foodist and all of that. And I felt so amazing. It was magical. And I felt, it's like, I felt 18. I'd walk. Weight losses are there, but and which is important, but it was more than just the weight loss. I had taken another course, not a course, but there was another physician I'd worked with who, when my cholesterol was high, she put me through this, 500 calorie a day diet, and it was some supplements and things like that. And I lost a ton of weight there too, but my LDL cholesterol never did go down in that regimen. And she wanted to put me on some meds, and I didn't want to take it. But on this program, my cholesterol went down. So not only did I change in body habits, but the biochemistry of my body changed. And I felt the difference too. I woke up, my sleep was better. I woke up energetic and so on and so forth. So there was a definitive change in how, that I sensed practically. And of course, my numbers improved. So this was something I said, this is something completely different than what I'm aware of. So then I started to implement this in my practice, one patient at a time. And I kid you not, and the kind of patients I saw, that I see, these are not the routine people coming in with routine problems. These are people who've had quadruple bypass, 6 stents, and the heart is pumping at 10%. They've got diabetes, they have arthritis, they've got kidney failure, they've got multi-organ failure. They're walking, talking, nearly dead patients. So these are very sick people. So I would implement, a juice feast or a raw detox. In 7 to 10 days, they would come back, and I would write out the menus and things like that. And so I just saw amazing changes that I'd never seen. And I practice in the largest medical center in the United States, in the world, in most cases, is the Texas Medical Center. And so we see all sorts of things. We have all advanced technology. So I had the benefit of having some of the most elite training in the largest medical center in the world. And I had that experience, was able to juxtapose it with natural plant-based eating. And I kid you not, natural plant-based eating by far trumped everything I had over here. And it made such an enormous impact on me in terms of the effectiveness that I said to myself that this is very early on. This is, I forget, 2001 or whatever. I said, there's no way that I cannot figure out how to implement this in my practice. And that was the time before I had the restaurant or anything. I had no way in terms of knowing how I was going to implement this. I just knew that I had to do it because it was so powerful. Now, I know this, I said a lot, but
I want to just ask this question. So you did the 32 or 30-day juice feast, and then you felt amazing. Your LDL went down. Your cholesterol was great. Did you continue that juicing, or did you go back to some other style of eating?
So great question. So after the juice feast, I said, okay, I will eat a vegan diet. Now, I started the vegan diet where I started eating cooked vegan food. And after breaking the juice feast, you have to break it slowly. And so I broke it with, fresh fruit for a few days a week. Then I ate raw for about, maybe several weeks after that. Then I gradually integrated some cooked foods. So I said, eating a vegan diet is healthy. So, there were some vegan restaurants. There was a Chinese vegan restaurant I became aware of. And of course they had, sauteed and fried vegan food. So it wasn't hard for me to eat a vegan diet. But one thing I learned, and it's a great question you asked. So did I continue? I continued on a vegan diet. However, I continued to eat processed vegan food. So I would learn that, when I ate these other foods, my health condition would regress. I'd put on more weight, whatever the case is. And then every year I did a juice feast. I didn't always do 30 days. I'd do 20 days, maybe 15 days or whatever. But every time I did a juice feast, I felt amazing. And so I said, wait a minute, there's a difference here. And so then I started to, and of course I would, speak to my mentor, John Rose, and of course he was more raw foodist. But over the years of doing juice feasts, I didn't cut out certain foods. Even though they were vegan foods, I knew they were bad. Obviously, fried stuff went away. Chips went away. Certain breads, breads went away, et cetera, et cetera. And certain grains, the way they were processed, they went away. And so over time, I learned that there was a difference in what was plant-based foods. And a big difference was how it was prepared. And then I also learned, organic versus inorganically grown foods. I learned that. So did I continue? Yes. But my path of continuation was more of a journey of a different type in that I learned the difference in terms of how food is prepared. So if you look at my book, The Food Prescriptions for Better Health, it talks about this food classification system, and we rank foods not only based on the fact they're plant-based or not, but you can have a vegan diet where the foods that you, depending on how you prepare the foods, it can be ranked right next to steak and chicken because the way it's prepared. And so my continuation was a continuation from a learning standpoint of still evolving. And my diet is still evolving because now I'm learning more that I need to eat more local, regional grown food and so on and so forth. So I'm working to build my garden in the back. I've got to probably get a professional person to come and help me. I don't have the time to do it. But that whole process of evolving, eating more naturally and things like that. And then it's kind of evolved beyond the eating. I do more grounding and getting outdoors and so on and so forth, which I'll get into later. But to answer your question, yes, I did continue, but the juicing was more episodic, and I use it now for patients as an episodic therapeutic approach in addition to the regular plant-based diet.
Yeah, thank you for explaining that, because a lot of people, we find that a lot of people they think that, first of all, nutrition is always evolving with all of us, and we're always learning new things and changing things up. But a lot of people just think that, oh, I'm going to eat vegan, it's going to be healthy. And it's not always the case. And as you just mentioned, it's so easy to be an unhealthy vegan, and the food is so different. So we have to really pay attention to the types of food that we're going to be consuming.
And one thing I'll say along that lines, and I know you guys in the vegan community, there are a lot of us in the vegan community who say, well, I'm an animal rights person, so I don't care about the health of the food. I just, as long as it's vegan, I care about the animals. But you have to understand that, if I sell or feed you some fried, okra, fried whatever, oil sauteed, and I give it to you as another human being, and it's an unhealthy food, you as a human animal is not being protected.
Yeah.
So we need to promote the optimal food for everybody, not because we think about all the animals, the human animals and the non-human animals. That's my take on that.
And I even take that a little bit further and say, start with your own animal. Start with yourself, because if you're healthier, if you're happier, if you're a weight where you can move in whichever which way form you want, then you're able to do more for whatever kind of activism you want to do. We volunteer on a farm sanctuary, and I need to jump the fence, get in with the hogs, grab their bowls before they see me, and get my little tuchus out of there before they charge me. If I were just eating a vegan diet and not taking care of myself and not being as agile as I am and the weight that I am, I don't know how I'd do that without getting my leg bitten off.
Oh my goodness. Wow. That's pretty aggressive work there.
Oh my God, the adrenaline, I'm telling you. So tell us a little bit about complex medical illness, because you kind of alluded to it before, people coming in and, kind of having a little bit of everything. But why don't you break that down and what that means for the listeners?
Yeah, great question. So, as I alluded to earlier, as a cardiologist, we see a lot of patients with complex illness. And medicine, just a quick side point, in medicine, the way we practice in the United States, it's very segmented. So I mentioned my background as a cardiac electrophysiologist, and my training started with internal medicine, which is a broad aspect of adult medicine. And then I get subspecialty training in cardiology, and then cardiology divided in certain segments. And cardiac electrophysiology deals with the electrical conditions of the heart. We deal with people with sudden cardiac death and atrial fibrillation and other arrhythmias. And then the other aspects of cardiac structure, heart, and intervention, and so on and so forth. So medicine's so segmented. So then you have a patient who may see their primary care physician or general physician, who then, if they have complex issues, have to go get shipped off to different subspecialties, endocrinologists, et cetera. And so if you have a patient who has complex medical issues, the typical approach that we take in our way of practicing is very segmented. So that person may have 4 or 5 different doctors who are taking care of one little segment, and they get a prescription for their diabetes, a prescription for the heart, this, that, and the other, and so on. And these patients who are very complex oftentimes are getting probably the best care. I'm going to try to say this as nice and politically correct as I can. With all great intentions. I mean, we in the medical community have great intentions. Our training and background, I don't think has equipped us, but the sickest patients probably are the ones who probably need to have the more global care, because that's when you really need to put everything together. But the system is designed to where it's so segmented. So if you look at a complex patient, the typical complex patient I see is one that has multiple organ systems that are overtly dysfunctional. So let's say someone who comes in with heart failure. Heart failure is the inability of the heart to circulate blood commensurate to the body's needs. That's kind of the basic definition. Typically, it's a heart that's weak. It doesn't squeeze very well, but sometimes hearts are very stiff. And so you can have a weak heart and a stiff heart, or one that's weak or one that's stiff, and so on. It just doesn't do what the body needs. So then that can set up other problems. The kidneys can then start to fail. The liver can start to fail. You have GI system and so on. You have people with liver failure based on multiple medications. So the complex patient comes in with a myriad of dysfunctions in organs. And so it becomes very difficult to manage that individual, because from the allopathic medical standpoint, if the blood pressure is very high and they're swollen, etc., when I prescribe medication to treat these problems, these medications may have adverse effects because the body doesn't metabolize them very well. So I may give you something for your heart rhythm disorder because your heart rhythm disorder is out of whack. Your heart's beating too fast and erratic, and that's leading to low circulation. But when I give you that medicine, because the liver is not functioning well, then the liver's at stress. Or I give you another medication to control swelling and may put the kidneys in more stress. And so it's a very fragile person physiologically and biologically, to where you have to be very careful in terms of how you manage them. So these are patients that are very, troubling and can be very difficult to manage, largely because, they have multiple organs that are dysfunctional. And the person's ability to get better depends on their innate biochemistry and physiology to help them get better. It's just not depending on what surgery I do or what medicine I prescribe. It has a lot to do with how much the body is able to recover and how much reserve the body has. So the complex medical patient, as I define it, is a patient that has multiple organs that are stressed and they have very little reserve, and you're walking a tightrope in order to get them from one part to the other, from point A to point B in terms of their health. So that's kind of the basic definition that I give of the complex medical patient.
Hi everyone, I'm Camille Labchuk, one of Canada's leading animal rights lawyers and the Executive Director of Animal Justice.
And I'm Peter Sankoff, author, blogger, lawyer, and criminal law and animal law professor at the University of Alberta.
Together, we host the Paw and Order podcast, Canada's only animal law podcast brought to you by Animal Justice.
We put out new episodes every 2 weeks, bringing you in-depth analysis of animal law issues in a way you don't need to be a lawyer to understand.
We feature some incredibly interesting guests, and we bring you all the latest animal law news from around the globe.
So please listen to Paw and Order on your favorite podcatcher.
Thanks for listening, and now back to the show.
There's so much in there, and I heard you say the words get better. And then when I think of medicine, I think of suppressing, not conditions, but suppressing your symptoms. Does the general medical profession see a difference between getting better and suppressing symptoms?
Yeah, that's a great question. By and large, what we do is more along the lines of suppressing symptoms than getting better. I'll put it that way. I don't want to say it. I don't want to make an absolute statement. There's some aspects of getting better, but by and large, and that by and large, maybe it's 90%. I don't know, but it's a large percentage given toward suppressing symptoms. What do I mean by that? So, for instance, someone with high blood pressure. Let's just take a simple condition like high blood pressure. The standard is to start you on a medication to get the blood pressure down. Well, okay, an elevated blood pressure, there are two aspects of it. There's one aspect of elevated blood pressure that has to do with the elevated blood pressure itself being a signal of a problem that's deeper inside. And of course, the elevated blood pressure itself has adverse effects on the body. If the pressure is elevated, the heart's beating against elevated pressure, that puts more stress and strain on the heart and other vascular structures, so on and so forth. So the elevated blood pressure itself can be a problem, but our focus is that let's get the blood pressure down, and therefore we have addressed the problem. And the answer is not necessarily, because the elevated blood pressure is like the alarm. So if you have a fire in your house, and let's say you're away from the house, and you get the alarm on your phone, your fire alarm in your house goes off on your phone, and it says, oh, my alarm has gone off and it's making noise, so I'm just going to disable the alarm. So you disable the fire alarm, but you don't put out the fire. And that's what we do a lot of in medicine. We're disabling alarms. So maybe a little bit of elevated blood pressure, we give them medication to reduce the blood pressure. Okay, fine. The blood pressure's fine. You're on your medications. Great. I'll see you in a year. Cholesterol's a little bit up. Oh, we give them medicine, reduce the cholesterol. But the elevated cholesterol, even though elevated cholesterol itself can contribute to problems, but the elevated cholesterol itself is a sign of an underlying problem. So it's not enough to simply reduce the elevated cholesterol by reducing medication. So to answer your question, much of what we do in allopathic medicine is toward treating signs and symptoms of illness, but not necessarily treating the illness itself, which is an underlying biochemical and physiological imbalance that the body's dealing with. And that needs to be addressed from a more global approach, not from an isolated approach of giving one medicine or the other. I use medication, but I use them only transiently and try to give myself time to get to the root of the problem.
And that's the key. We want to get to the root of the problem and treat the underlying cause, which most people are not getting that done right now. And hearing you explain these complex medical illnesses, it brought me back to the ending of Forks Over Knives, where they said all these illnesses, is it possible that there's one solution? And that solution is so simple that it's plants. Eat more plants.
That's right.
And so I guess the question at this point is that really the case? Is it that simple for people to solve these complex issues by eating more plant-based, by eating more plants? And is that the only solution, or is that the right solution for everybody? There's so many pieces to that, I know.
No, these are great questions. I hope I'm not going on too long in my answers. You're just asking these profound questions, so I can't.
No, it's great.
The thing is that, if you look at my book, and there's a picture I draw of a tree, and the tree, the trunk of the tree, and it got the branches, and the branch has all these illnesses, and then it has the trunk of the tree, the root of all these is poor nutrition. And if I were to critique my book, I would change that tree, and poor nutrition is a core part of it, but I would expand that beyond just poor nutrition, and unless you expand the definition of nutrition, but it's an imbalanced personal ecosystem. Now, what do I mean by that? Your body is an ecosystem. If you think of the microbiome, the trillions of cells, and the more microbes that live in this thing, we have our own cells and things like that. And then you think of the things that we think about and read, and you asked about gratitude earlier, and so if we look at eating plants, I think, is the right answer from the standpoint of the physical nutrition that we take in. But there are many things that we take in our bodies beyond that, from a spiritual standpoint, an intellectual standpoint, et cetera. But the environment, our local ecosystem is affected by our global ecosystem. I started personally doing things like grounding. Here in the States, there are people, everybody's afraid of the pandemic, and my patients staying indoors with their mask on, under the covers and all that stuff. And so, that's the worst thing to do. You need to get out, take your shoes off, short pants, walk. Now, I know you guys.
I was just thinking about an inch of snow.
But, even in the snow, you dress up in the snow and get out even then. You've got some exposure. The point is, and when the weather allows, you need to expose yourself to the environment, your natural environment. Get out, get dirty. Like my workouts now, my training comes over, I'm starting to work out in the backyard now. I don't work out in my indoor gym anymore because that's where the body belongs. So to get to the point, the simple solution, I think it goes beyond eating plants. Now, and of course, when you say eat more plants, that's true. But then, where are these plants coming from, and what's done to the plant before you eat it? And so there are a lot of little nuances. So I think there's the simplicity of the state is eat more plants, and I think that is a step in the right direction. But when I see my complex patients, and we've been challenged. I guarantee we have people coming in from heart failure, with LVADs and all that, and so we've had to really step back and get a broad perspective on things. But I think a major part of the answer is eating more plants. I don't think it's as simple as that. Largely because our lifestyles have gotten so far away from what God intended us to be, that not only are we eating poisonous foods, which I think is the biggest impact on our health, but our environments are bad. We're sitting indoors all the time. And of course we're in front of computers now, but in front of computers and so on and so forth. And I think we need to get away from that and get more into a natural space. So yes, eat more plants is a fundamental approach, and that's the foundation of what we do for a therapeutic standpoint in our office. But I guarantee you, I see people come in and say, "Yeah, I've been vegan for 13 years," and they have a whole long list of health issues. And so we need to get into that whole process and understand that better.
Yeah,
I think that we saw that with my father. My father is overweight and has been diabetic for a very long time, and with diabetes and overweight comes all of these other diseases. And when he first went plant-based, I mean, we saw his sugars cut right in half. It was scary because he was waking up in the middle of the night and eating orange juice because he was eating at our house and still taking the same amount of insulin that he was taking at home. And then we did see him start to lose weight over time, but none of the other lifestyle changes really kicked in. And they went from whole foods to more processed foods, the easy. And then he started gaining weight back and sugar levels continued rising. And there's more work that you need to do. And for some people, yes, absolutely. Only changing diet makes a huge difference. But maybe they're exercising already, or maybe their stress levels are lower, or maybe they are walkers, or maybe they live in the country, fresher air, don't have mold in the house, don't work near oil refineries, and the list goes on. And some people had healthy childhoods and got sick as adults, and some people had unhealthy childhood and are doing all the right things as adults, but because of that history, it's still in the body, it's still in the genetics, it still needs to be detoxed too.
I want to you hit the nail on the head with that unhealthy childhood, and that's one thing I'm beginning to work on with my patients, because we had on our YouTube show, we had a guest on, and we talked about the microbiome and the whole aspect of a healthy childhood, what your parents are exposed to before you conceive, and what you're exposed to in utero, and then what you're exposed to as a very young child growing up, the food, the environment, etc. It sets a foundation of your health. And so you grow up, and some people have weaker foundations, and those individuals are much more challenging to deal with. And so, as you point out, there's more work, and like for those patients, we put them on raw detox. We do intermittent water fasting. We try to get them outdoors and things like that. So we're putting together intense regimen where episodically people are dosing themselves, if you will, with an aggressive cleansing process that's both on the food side, on the functional side, to where they come through. Patients with cancer that we see, we have to have them on intravenous vitamin infusions and juice feasting and intermittent raw feasting while they're getting chemotherapy to enhance their body's ability to tolerate the chemotherapy, to also enhance their body's capability of improving itself. So that foundation, as you point out, what they're exposed to as children is extremely important. And to make that differential is helpful. And so it's an amazing thing that we have to deal with certain patients, because many patients are more tough and more complex. And like you said, they have less healthy childhoods, and they may be doing a lot of the right stuff, but it's not working because it's not aggressive enough. And so I think that's something that I found personally, that I have to be more aggressive over time, because just eating more plants for some people isn't enough, because there are more foundational health issues that they're having to address.
And I find that with a lot of our clients too. And I actually found that with myself, because I believe that I was allergic to dairy and didn't know. And that's why I had, 8 to 12 ear infections a year growing up, well into my 20s. And then it turned into sinus infections and throat infections. I hope my parents don't listen to this. My mother smoked in the house as I was growing up too. These are all things that I was exposed to that, now thriving with mental illness, now, having gone through some of the cortisol and adrenal issues that I've had in the past, it all makes sense to me now, because I have a big understanding of that bigger picture, and not everybody is as easy as eat more plants. But for those who are, God bless them. It's amazing, because the turnaround that people get is simply amazing.
Yeah, no, you're right. You mentioned several things. The infections, then the treatment for those infections were antibiotics and various things which affected the microbiome, which the foundation of that had probably ill effects. Personally, during my medical training with long hours, it was nothing for me to work 100 hours a week. 12 hours was a short day, and that was on weekends. Being under stress with call at night, my adrenal glands were burnt out, just in terms of just that lifestyle. And so, I became, aware of that and making those changes. And so it's really a collective number of things. And what we're working on in our programs is putting a comprehensive, healthy lifestyle approach where we bring all of these components together. And it's not like an individual can make all of these changes overnight. And oftentimes patients come in very ill, and I start to talk about some of these things, but we take it in stages. And as I was sharing with a patient yesterday in clinic, and so, it's like, okay, we want you to get 100% plant-based, but that's just kindergarten. The next level is, okay, how are you preparing the plants? And then where are you procuring your food from? Are you growing it? How much are you growing? Are you getting it region locally? Then, what is your outdoor exposure and so on and so forth. So there's so many things, removing toxins from the home, the paint on our walls and the things we use to clean our clothes. All of these things have an impact because you're ingesting things from different sources. It's just that food is the most dominant source of ingestion of toxins. But the other important sources, depending on what your needs are, you need to be more aggressive on all fronts. And so it becomes quite an ordeal to get people educated to make these fundamental changes. And it starts here. It starts here from the standpoint of understanding what you need to do and being determined and being progressive in that approach. Oftentimes we get patients say, well, can I have just a little bit of, a cheat day every once a month or whatever the case. And it's not a mindset of can I have a cheat day? The mindset is, how can I get to this new level? How can I get to where I no longer want to consume these foods? How can I get to it's like a drug addict. You want to treat the alcoholic or the drug addict to where they no longer desire the alcohol. They no longer desire the drugs. You got to change your want-tos. And as you start to experience a life at a higher level, then you get a new high in a natural way because you're feeling better and you no longer want the other food. So my comments to my patients I say your illness isn't diabetes or heart failure or high cholesterol. Your illness is your desire for the bad foods. My cure for you is to cure that desire for the bad foods. And then change your desire to eat the best food, the desire to get outside and exercise, the desire to live life at a higher level. When I change your want-tos, then that's the whole thing. There's a book in Psalms 37, and the Bible says, God will change the light of the Lord, God will change the desires of your heart. And what it means that he's going to change your evil desires to godly desires. And that's the same with the palate. We're going to change your desire for poison and toxins and change it to something that's more desirable, something that's, that's good for you. You want broccoli, you want spinach and kale. Anyway, I went on too long.
No, so that was, you answered my question pretty much, because I was going to say, if somebody listening wants to make a change, like where do they start? And you started saying it was the plants, you start with the food, but then you switched over to the mindset. And I think the mindset is really where we need to begin. And I'm wondering, maybe you have a simple exercise that you could share with us that our listeners can use to get to those want-tos that you just mentioned.
That's right. So what you do is that you go to the extreme. So our standard approach is moderation, right? So, have a meatless Monday or whatever the case is. And those things are all wonderful and well-intentioned. But I go counter to that. I say, okay, really what you want to do is you want to go to the extreme for a finite period of time. So one thing we do, we put people on raw detox. So we call it grass and water, but it's not quite as severe. But we put them on a raw detox for a finite period of time. We choose 4 weeks, whatever period of time. I like for it to be longer than a week, maybe 2 weeks or 4 weeks, ideally 4 weeks. And you do that 100% and you fight through that. So what that does? It has a biochemical change on your taste buds. So there's some biochemistry going on. And after you come off, like I did the juice feast, he said, well, did you continue? I didn't continue with raw juice and raw, but it had a biochemical change. So it got me to a different level. So you start off here and you go here. And so your taste buds change. The other thing we do is we have people consume bitter food. So I have a bitter breakfast. So we'll have them eat a mixture of dandelion greens, watercress, and kale. Now, kale of those three vegetables is the mildest of those vegetables. Now, if somebody's eating fried chicken, kale's going to be bitter. So I take them all the way to dandelion greens, wild grass, so bitter breakfast. Every morning eat the bitter. Well, what that does? That takes the taste buds, and it gets you used to bitter foods. And so it helps break your craving for sweets and processed foods. So when you give yourself a bolus dose of super nutrition, it helps push you along that route. So the simple exercises are raw plants for a finite period of time, plus or minus super bitter foods for breakfast or certain meals, designated meals with super bitter foods and water, which helps change the biochemistry. Because you really need to change the biochemistry of your tongue to then switch your desires toward foods that are bitter.
Amazing. It's such a great idea. And I remember the first time I tasted a real strawberry after my taste buds have gone through that change, and it was just like a pow of serious flavor. Incredible. So many great tips, so much great information today. Dr. Montgomery, we appreciate you so much for being here with us on the Plant Trainers podcast. If people want to reach out and connect with you, where would be the best place for them to go?
Well, they can go to our website. It's active, of course, but we're redesigning. The new website will be up, but you can go through to montgomeryheart.com. That's an easy way. We have an online course, online.montgomeryheart.com. They can go through. If you're in the States or wherever you are, you can always call the office at 713-599-1144. That's 713-599-1144. We have a wellness email of people that send questions at wellness@montgomeryheart.com. You can find all of this on our website. But yeah, and then just look us up on YouTube. We have a YouTube show, Montgomery Heart on YouTube. And we share a lot of this information on a Monday live show, plus healthy videos that we share with the general public.
This has been amazing. Such good information. I really do hope that people follow your YouTube, and do what they can to improve their quality of life. Thank you so much for your time and for your mind and for your words. We really do appreciate it.
Well, thanks for having me, and thank you for the work that you're doing. This is amazing work, and I mean, keep up the good work. I mean, the world needs this, and I appreciate you allowing me to participate in the great work that you're doing. Thank you.
Thank you.
Thank you. And all of those links that you talked about will be found at planttrainers.com.
Wonderful. Take care. I'll be in touch.
Thank you all so much for listening to this edition of the Plant Trainers podcast. We want to make sure that you subscribe on iTunes, Google Play, iHeartRadio, Stitcher, or any other podcasting platform.
We really appreciate the feedback we receive from you. Every time we get a 5-star rating or review on iTunes from one of our fans, it really helps other people find us just like you did.
Thanks so much to our patrons. To become a patron, visit us at patreon.com/planttrainers. Even supporting us with $1 really makes a difference in the quality of the show.
And don't forget to connect with us on Instagram and Twitter. Our handle is @PlantTrainers. Like Plant Trainers on Facebook, join our newsletter, and check out our website at planttrainers.com for awesome recipes, a list of our services, and of course, our latest podcast.
We encourage you to email your questions to info@planttrainers.com so that we can help you improve your quality of life through nutrition and fitness.
So we hope we've inspired you today. Join us again next time. And have a healthy day. Or is that too corny?
It's a little cheesy.